big group here tonight. And I'm looking forward to talking with all of you. I'll talk for a good chunk of the time, but then we'll definitely leave some time for questions at the end. So please, if you have any questions along the way, put them in the chat or just let me know, and I can answer them either as we go along or at the end. So I am going to share my screen. Can people see that?
Yes, I can.
Okay, great. Okay. So I'm going to start by just giving a general overview about prediabetes and type 2 diabetes, and then I'm going to move on and talk a little bit about BEATDiabetes, which is a free text message-based program for people with prediabetes and type 2 diabetes. And then at the end, I'm going to spend a little bit of time talking about some practical tips for healthy eating and active living. So this is a graph that looks at the change in the rates of diabetes over about the past 60 years. And you can see that the numbers have really gone up dramatically. This goes back from around 1960 up to more currently, and the numbers have risen really steadily. The yellow is a percentage of American adults with diabetes, and then the blue is the number of people with diabetes. And they both have gone up pretty consistently, kind of accelerating in the 1990s. And so the most recent numbers, there are now 34 million people with diabetes, and the majority of those people have type 2 diabetes. So 32.5 million people with type 2 diabetes, around 1.6 with type 1 diabetes. And we'll talk in a minute about the differences between those two. And the problem is that 32.5 million, even though it's a ton of people, it's 12% of the US adult population. That's really only the tip of the iceberg, because there are another 88 million American adults, or close to a third of the population, who have pre-diabetes. And the really concerning thing is that only about 15% of the people with prediabetes even know that they have prediabetes. So they don't know that they're at higher risk for diabetes and can't make the changes necessary to hopefully keep them from going on to develop type 2 diabetes. And diabetes is associated with a lot of different health problems. It's the leading cause of blindness and non-traumatic lower limb amputation and kidney failure in the United States. And it's also associated with higher rates of heart attack and stroke and cardiovascular death. And it's the 7th leading cause of death in the United States overall. And it's also super expensive, both for individuals and for a country. Their most recent numbers is that the US is spending $327 billion a year on diabetes-related care. And it's estimated
Well, I'm proud to hear this.
Now, one in 7 US healthcare dollars are going to diabetes care. Did somebody have a question? Okay. So what is diabetes? Diabetes is a disorder in glucose or sugar metabolism that's caused by an impairment in the body's ability to either make or respond to insulin. And the official name is diabetes mellitus. Diabetes is from the Greek for siphon, or running through. And that's because if people have really high blood sugars and uncontrolled diabetes, they have high volume urination, they're super thirsty all the time. So it's like the water is just kind of running through them. And then mellitus comes from the Latin for honey. And that is because if people have really high blood sugars and some of the sugar comes out in the urine. And believe it or not, in olden days, fortunately long before I was an endocrinologist, doctors would actually diagnose diabetes by tasting the urine to see if it was sweet, or sometimes pouring it out on the ground to see if it would attract ants and other bugs. So insulin works basically like a key that allows glucose or sugar to get into the cells. And so in somebody without diabetes, what happens is people eat a meal that includes some carbohydrates or sugar. That sugar gets absorbed into the bloodstream, and then that gives a signal to the pancreas to release insulin into the bloodstream. And that in turn allows the sugar to be taken up and used in the liver and in the muscles, and then keeps the sugar levels in the blood normal. So you can see that kind of here. Again, this is somebody without diabetes. The healthy pancreas is going to release the insulin. The insulin is going to kind of act like that key in the lock, and then that's going to let the sugar come in. So for people with type 1 diabetes, the problem is the pancreas just stops making insulin altogether, doesn't make any. So the insulin isn't around to bind to the insulin receptor and kind of turn the key, and the sugar isn't able to get into the cells and stays outside the cells and makes the sugar in the blood go high. With type 2 diabetes, the problem is a little bit different. Here, the pancreas is actually still making insulin, especially in the early stages. It can even actually be making more insulin than a person without diabetes might be making, but the insulin just doesn't work as well. So even if people have insulin, it doesn't have the same effect on the receptor and then inside the cell. And so the sugar is still not able to get into the cell as well as it should. Unlike type 1 diabetes, it's usually kind of absolute, so no sugar can get in the cell. With type 2 diabetes, it's usually more of a kind of partial defect. So I'm going to spend most of the time today talking about type 2 diabetes, but I did want to give a quick overview of the difference between type 1 and type 2 diabetes, because I think it can be a little bit confusing. So type 1 diabetes, like I just said, is because of a lack of insulin, and that usually happens because of an autoimmune destruction of the beta cells in the pancreas. And those are the cells that actually make the insulin. And the typical patient with type 1 diabetes is young and thin. So you may have heard the name juvenile diabetes in the past, and that's because it tends to affect young people, although we know now that it can affect people of any age. And it can affect overweight people too. It's just kind of the typical patient is younger and thin. And usually it presents pretty dramatically. People get really thirsty, they have increased urination, they lose weight, even though they're eating even more than usual. And it can have a really dangerous complication called diabetic ketoacidosis, which can land people in the hospital and even cause death if people don't get insulin treatment. And the only treatment for type 1 diabetes currently is insulin, just to replace what the body's not making. So another old-fashioned name for type 1 diabetes is also insulin-dependent diabetes, because people with type 1 diabetes are dependent on insulin to stay healthy. So type 2 diabetes is a little bit different. The problem here is impaired insulin action. And usually when doctors talk about it, they'll talk about something called insulin resistance, which is a problem, that the insulin is around, but it's just not working. The typical patient is in middle age or older, often overweight, but again, this isn't universally true. So we're increasingly seeing younger people, even kids, who are developing type 2 diabetes. And depending on your kind of genetic risk, there's a range of weights that people can develop type 2 diabetes at, although it definitely, the risk of it goes up as people gain weight. And one of the good and bad things about type 2 diabetes is that usually people don't really have much in the way of symptoms unless their sugars are really out of control. So this is good. We obviously don't want people to feel bad, but part of the problem is a lot of times people can have diabetes for quite a while before they know that they have it. And sometimes people can even get to the point where they're having complications of diabetes, problems with their eyes or kidneys or feet. It's their initial symptom. So that's why it's important to talk to your doctor about your risk, to get screened, so that you make sure that if you have it, you know that you have it and can deal with it. And then for type 2 diabetes, unlike type 1 diabetes, there's a whole range of treatment options. So for some people, diet and exercise, maybe a little bit of weight loss is enough to get it adequately controlled. If that's not enough, we have a whole range of pills that people can take. There are some non-insulin injections, and then some people with type 2 diabetes do end up needing insulin. So what is the effect of all that extra blood sugar in the bloodstream? The problem is that it damages the blood vessels in the body, and it can damage the small blood vessels, which we call the microvasculature, and also the big blood vessels, which we call the macrovasculature. So on the small vessel side, it can have effects on the eye. That's why it is one of the leading causes of blindness in the United States. It can have negative effects on the kidney, which is why it's a common cause of kidney failure and the need for dialysis. It can cause nerve problems, especially in the feet, sometimes in the fingers too. You probably have seen some commercials on TV for people who have nerve pain related to diabetes. Another problem with this is sometimes people can't feel their feet, so it makes them more prone to get ulcers, because they don't know that they've injured their foot until it kind of becomes a sore that's problematic. And then when we look at the big vessels, it causes higher rates of stroke and heart disease, and also causes poor circulation in the extremities and the feet. And so the combination of the poor circulation and then the nerve damage in the feet can be really dangerous and lead people to end up needing amputations, because people can get non-healing ulcers because of inadequate blood flow and then the nerve damage too. So even though people may not feel bad with diabetes, that the extra sugar is causing lots of damage unless we can get those blood sugar levels down. So what are the risk factors for type 2 diabetes? There is a group that people just have and they don't have much control over it. And then there's a group that people can control and decrease their risk. So on the side of the things that we can't control, if you have a family history of type 2 diabetes, that puts you at higher risk. Everybody's risk for diabetes goes up as we get older. Men are a little bit more likely than women to get it. We also know that there are some associations. African Americans, Hispanic Americans are about 1.5 times as likely to get type 2 diabetes as white Americans. There are lots of different reasons for that, including healthcare disparities. But currently that is true. And then there are some health conditions like high blood pressure, a history of gestational diabetes, which is having diabetes when you're pregnant, and then a condition called polycystic ovary syndrome that can all be associated with increased risk. And then on the side where we can control things, we know that the risk of diabetes goes up as people gain weight, especially if they kind of cross over into being overweight or obese. And then we also know that kind of how active people is matters. So if you're just sitting around all day, then you're at higher risk for somebody who's getting regular exercise and has some activity in their life. So I think what we're going to do is just do a quick prediabetes risk test, and we can just kind of walk through this together. I think it's helpful, first of all, if you don't know your risk, it can help you figure out your risk. And then also, I think it just kind of drives home kind of the relative risk of some of those different factors that we talked about. So I'm going to ask a series of questions, and then you can kind of just count on your fingers how many points you have as we go through it. So are you a man? So if so, you get 1 point. Do you have a family history of type 2 diabetes and a first degree relative? So that would be a parent or a sibling. Do you have high blood pressure? If so, you get a point. Are you physically inactive? If so, you can give yourself a point. Are you overweight? And you can kind of just categorize yourself. So if you would say somewhat, give yourself 1 point, moderately 2 points, or very, give yourself 3 points. And then the last question is, how old are you? So if you're older than 40, give yourself 1 point. If you're older than 50, you get another point, so 2. And then if you're older than 60, give yourself 3 points. Okay, so count all your fingers up. And if your score is 5 or above, then there is a decent chance that you might have prediabetes, and you should probably talk to your doctor about getting screened for it if you have not already had that done recently. And the way that we usually screen for prediabetes and diabetes is to do a blood test. There are 2 that are done pretty commonly. One is called the A1C. So that is a test that looks at the average blood sugar over a 2 to 3 month period. And then the other common one now is a fasting blood sugar test. So that would be a test where your doctor tells you not to eat anything after dinner, after midnight, and then you come in the next morning and you have blood work before you've had anything else to eat. So that's just kind of a single point in time. The glucose tolerance test is an older test that we don't do too often anymore. And for both of these tests, there's a range of results. So for the A1C, if you're under 5.7, then that's considered normal. If you're between 5.7 and 6.4, that's considered prediabetes. And then if you're 6.5 or higher, that's considered diagnostic for type 2 diabetes. And the same kind of thing for the fasting blood sugar. If it's less than 100, that's normal. If it's between 100 and 125, then that's prediabetes. And if it's 126 or higher, then that would be consistent with type 2 diabetes. And the reason why it's important to know this, especially with the prediabetes, is we know that if people with prediabetes make some lifestyle changes, they can dramatically cut their risk of developing type 2 diabetes by over half. So it's a really big difference. And we know this from a study called the Diabetes Prevention Program. And this is a program where they had some classes which were about nutrition and exercise, and they recommended that people try to get 150 minutes of exercise or physical activity a week, so around 30 minutes 5 times a week. And then for people who were overweight when they started the program, that they try to lose around 5 to 7% of their body weight. So for somebody who was, for example, 200 pounds, that would be losing 10 to 14 pounds, so kind of modest weight loss. And then what they did was they kind of looked at people who did those lifestyle changes. So the people who did the lifestyle changes were in green. They took another group of people with prediabetes and they started them on metformin. So they basically treated them like they already had type 2 diabetes. And then they watched another group where they just kind of continued doing what they were doing normally. And they looked over a few years. And when they looked at 4 years, close to 40% of the people who didn't make any changes had already developed type 2 diabetes. The people who were on the metformin did better, but again, they were already basically on the treatment for type 2 diabetes. And then the people who did the best were the people who tried to make these lifestyle changes. And they reduced the risk of developing type 2 diabetes by 58%. So significant. So this is why it's so important that people kind of know that they have prediabetes, even though it's no fun to be told that you have it. It's a good chance to really make some changes and improve your future health. And then for people who have diabetes, we know that the most important thing is trying to help them get their blood sugars under control. So this is a graph that looks at people's risk of some different diabetes complications, depending on how high their A1C is. So again, the A1C looks at kind of average blood sugars. And if you remember, the cutoff for diabetes is 6.5. Usually if people have diabetes, the general recommendation is that people try to keep their A1C under 7. So you can see that marked here, that's the American Diabetes Association goal. And then if you see if numbers go up higher from that, the risk of all these complications starts to really go up. So the blue line is for retinopathy, so that's eye damage. The yellow line is for nephropathy, which is kidney damage. The green line is for neuropathy, which is the nerve damage. And then the red line is kind of another marker of kidney damage. So we can, you can see pretty clearly that as the sugars get higher, the risk of all these complications get higher. But the good news is, if you get down in this range, if you're all the way under 7, your risk really isn't that much different than somebody without diabetes, which would be this one down here. So we know that if we can help people control their blood sugars, then they can avoid a lot of the bad complications of diabetes that we worry about. So for type 2 diabetes, I'm not going to go too much in depth about treatments, but I'll give you kind of a quick overview. Usually we recommend that everybody tries to eat a healthy diet, to get some regular exercise, lose some weight if they're overweight to begin with. If that's not enough, then there are a bunch of different medication options that we can use. Metformin is the one that I mentioned before, which is probably the most common first line agent. But there are a bunch of other medications, both pills. Then there's some non-insulin injectables. You probably have seen these advertised on TV, like Ozempic and Byetta, Victoza. And then some people do end up needing insulin, especially kind of people who've had diabetes for a long time. For some people where their weight is really an issue, bariatric surgery like gastric bypass can sometimes also be a good option. So I can stop there if anybody has any questions. And then I can go on, or we can just have questions at the end.
I don't have any questions in the chat.
Okay, great, thank you. So I'm going to move on and I'm going to talk a little bit about beat diabetes. So one of the challenges, and taking care of prediabetes or type 2 diabetes is something called the 5,000 hour problem. And that's basically that people with type 2 diabetes and prediabetes only spend at most a few hours usually in direct healthcare encounters related to their diabetes, and certainly to prediabetes, it's probably way less than that. But how people do in the long term really depends on the choices that they're making during the other 5,000 waking hours when they're on their own, kind of in their regular day-to-day life. And there are a lot of things that we ask people to do to try to, maximize their health if they have prediabetes or type 2 diabetes, to make healthy food choices. And you guys all know this isn't just kind of one choice a day, this is numerous choices a day to make healthy food choices, to be physically active for people who have diabetes, to check blood sugars, sometimes multiple times a day, to take medications, including ones like insulin that require shots. So that's a lot, even in an ideal situation. And most of us don't live in kind of perfectly calm lives either. So we're trying to do all this stuff while surrounded by a bunch of distractions and temptations. So we all have kind of work and family responsibilities, financial responsibilities. We got to get the laundry done. We got to get kids where they should go. And then we also live in an environment where we're just kind of constantly surrounded by unhealthy, really tempting, delicious looking foods that are easy and more convenient maybe than making a healthy meal. Also, there's always something good on, Netflix or a computer game. It's sometimes hard to get ourselves motivated to get up off the couch to be active. So all of that can make it tricky. So BEATDiabetes was designed really as a way to help support people during those 5,000 hours and give people some extra support and motivation between doctors' visits to help them make healthy choices, to hopefully prevent diabetes if they have type 2 diabetes, or help them better manage their diabetes and avoid complications if they have type 2 diabetes. So the program consists of 3 components. There are tips and reminders, and then motivation. So the tips are practical advice on diet and exercise and diabetes prevention or self-care that are delivered by text 3 to 5 times a week. We try to focus on really simple, small, doable changes that people can kind of take on in their day-to-day life. They're not super complicated. And we customize the tips based a little bit on the sign-up form that people fill out. So if people smoke or drink soda or do the grocery shopping, have trouble walking, things like that, they'll get a slightly different group of messages. So here are a few examples just so that you can see kind of what the messages are like. So for example, the one in the middle, use the half plate rule, fill half your plate with fruit or vegetables, and be sure to stick to the half plate rule. If you go back for seconds, I think that's pretty representative. This one's, suggesting that people eat on smaller plates. This one's suggesting people take a walk after 15 minutes after you eat a meal, because we know that that can help improve blood sugar. So they're kind of small things like that. And we don't expect everyone to resonate with everybody, but hopefully you get some that are helpful that you can kind of build into your day-to-day life. And if people's data plans allow and they want them, then they can get some of the tips in image form, or you can opt out of that and get them all just kind of in just the words. The reminders are because, a lot of times, like I said, people are busy, and it can be, even if you have the best of intentions to check your blood sugars or take your medications, it's easy to get sidetracked and then get to the end of the day and realize, oh, I forgot to do that. So for people who want them, they can schedule text reminders to check their blood sugars or take medications or exercise. The timing and frequency of this is entirely up to the participant, and it's set up during the enrollment process and then can be changed over the course of the year if people want to change it. If people want a little bit of extra motivation in the form of motivational messages, we can add those. People can either design ones that kind of speak to them, something that they like to hear, they think that would be motivating for them, or why they're trying to get helpful. Or if people would rather just get general kind of inspirational and motivational quotes, we have a series of those that people can get to, which can either be, again, with some images or just kind of with words if people prefer that. And then the last component is rewards. And we think that the rewards are helpful because, like I said, a lot of times people with diabetes feel fine, and it can be really hard if you feel fine to make choices which are somewhat hard now to prevent complications that might not happen for 5 or 10 years. I think people are just kind of wired to be pretty present focused, and it's hard to pass up a cookie or, stop, turn off the TV and get up off the couch now to prevent kidney failure 10 years from now. We just kind of keep pushing it off and saying, oh, I'll do it tomorrow, and until the 10 years has passed and we're in trouble. So the idea of the rewards is to build in some short-term incentive for people to make some of these healthy changes and hopefully make it a little bit fun. So they're based on meeting A1C targets. So for people with type 2 diabetes, if you improve your A1C by 1 point compared to whatever the previous lowest was while you were in the program, or if you achieve that goal A1C of less than 7 that we use for most people, then you would qualify for rewards. And for people with prediabetes, if you can get the A1C or fasting blood sugar back into the normal range, then you would qualify for rewards. And the reward is entry into a $1,000 drawing that we hold 3 times a year. We do it 3 times a year because that's usually how often people get their A1C checked. And then if you have a bigger A1C drop, or if you meet your A1C target multiple times in a row, you can get bonus entries for doing that. And our results so far have been good. People who have participated in the program, who start the program with an elevated A1C, so an A1C over 7, have improved their A1C by an average of 1.1 points. And that may not sound like not very much, but it actually is enough to really make a difference. So this is data from a famous diabetes study that looked at kind of what the impact of each 1% improvement in A1C was. For a variety of different complications. So just that 1 point drop is associated with a 12% reduction in stroke, a 14% reduction in heart attack, 21% reduction in any diabetes-related complication or death, and even higher reductions in eye and kidney disease and amputation. So that magnitude of change is enough to make a long-term difference for people. And like I said, the program is currently free to people in Central Virginia with either prediabetes or type 2 diabetes. All people need is a mobile phone. You don't even need a smartphone, just any phone that can receive text messages. And you can stop it at any point if you decide that it's not helpful for you. So since it's free and you can stop it, there's pretty low risk for people to give it a try if they think that it might be useful to them. And so if you are interested, or if you know somebody who's interested, we'd love more people to take advantage of the program. So please share the word. People can go to our website, which is www.beat2diabetes.com. And I can put that in the chat later. You can learn more about the programs there, and that's also where you can access the sign up forms. There's also, I think, Star Hill, I believe, has some paper forms that people can fill out if they'd rather do it that way. And now I'm going to move on at the end, just spend a few minutes talking about some practical tips for healthy eating and active living. So as far as diet, I think diet and nutrition oftentimes can seem super complicated. There's always new information coming out. Some of it's really detailed and contradictory. So I really love this quote from Michael Pollan because it's so simple. And I think if you really kind of take it in, it has probably 90% of what you need to know about eating a healthy diet. So what he says is eat food, not too much, mostly plants. So what does that mean? Eat food, and here he means kind of eat food as close to its natural state as possible, and not kind of what he calls food-like substances, which are kind of highly processed food. So another quote from him is, if it came from a plant, eat it. And if it was made in a plant, don't eat it. So, if you're trying to figure out kind of what is highly processed and what's not, some signs that things might be processed or that they come out of a box or packaged. If your great-grandparents wouldn't recognize it as food, it's probably been highly processed. And if it has a bunch of ingredients or ingredients that you can't pronounce, that's another tip off that it may have been highly processed. And we know that kind of highly processed and ultra processed foods are associated with higher risks of diabetes tip when you're doing your grocery shopping is to try to focus on the outside edge of the grocery store. That's where most grocery stores keep their produce and meats and things like that. So if you spend most of your time around there and only kind of go down the aisles, kind of if you're looking for something specific, it can kind of keep you away from a lot of that tempting, highly processed food. So his next part of that is not too much. And this has to do with portion size. And I think portion size can be really tricky in the United States because our portion sizes have gotten so distorted over time. So these are a couple of graphs that look at the change in portion sizes over the past, 50 or 60 years. So the size of a restaurant meal is actually 4 times larger today than it was in the 1950s. So it's a huge change. And even kind of the dinner plates that we use in our houses have changed pretty dramatically in size. So back in the 1960s, the average dinner plate was only 8.5 inches. It's kind of gradually increased over time. So now the ones that are commonly sold as dinner plates are 12 inches. And you can actually fit almost twice as many calories onto a 12-inch plate as an 8.5-inch plate. And part of the problem with this is people are also kind of wired to kind of fill up whatever bowl or plate that they have in front of them, and then to finish off whatever is there. It's called unit bias. And so there have actually been some studies that show just by switching to a smaller plate, people will serve themselves less, but actually won't even notice that they're serving themselves less. They won't feel deprived in any way. You'll just kind of adjust and what's going to look teeny tiny and not enough on a 12-inch plate. If you switch to a 10-inch plate, will be nice and bountiful. And so people, it's an easy way to eat a little bit less without even knowing that you're doing it. You're kind of tricking yourself into doing it. So this is kind of a continuation on the portion size. So one is just to eat off a smaller plate. So for, the easiest way to do that is usually just to switch to kind of the salad plate instead of the full plate, and cutting down from a 12-inch plate to a 10-inch plate usually results in around a 20% reduction in calories, which is a lot. And then the other thing is just to be aware when you go to restaurants that they tend to have really big portions. So it can be super tempting and seems like a good deal to supersize things, but it's best not to do that. And if you go to some place where you know that they have really huge portions, another thing to do is to eat half a portion. So split it with a friend, or you could ask for half of the meal to be packed up even before it gets to the table. That way you get, 2 meals for one, really. If it comes out to you, if it's already on your plate, you're much more likely to eat it. So that's why it's good to have it packed up before it actually shows up on your plate. You'll probably eat less that way and won't miss it. And then mainly plants has to do, with plants are just a great source of fiber. They also have all kinds of vitamin and minerals, which are really good for us. Fiber is important because it helps us feel full and it slows down the absorption of sugar. So even if we eat sugars, they won't hit our bloodstream so quick and cause huge blood sugar spikes. It kind of comes on gradually, which is good. And we know that high fiber diets are associated with lower risks of type 2 diabetes and also heart disease. So I think the easiest rule here is just to try to fill half your plate with fruits and vegetables. It's a really simple, easy rule to remember. The one caveat is that potatoes and other starchy vegetables don't count. So you can't fill half your plate with French fries. That doesn't count, but half with a salad or other vegetables. And then the other things that go along with this is if you go back to for seconds to try to follow the same rule and fill half your plate with vegetables and fruits again. And then when you're doing your grocery shopping, you really have to fill half your cart with fruits and vegetables in order to be able to fill half your plate with fruits and vegetables. But it's a good way, you can have pasta, you can have pizza, on one side, but that keeps the portion size reasonable and makes sure that you're getting kind of lots of healthy, filling produce on the side. And then one other thing about healthy eating is that, willpower is really hard for most of us to rely on. So one of the good things to do is really just set yourself up for success by making the healthy choice the easy choice and how you set up your environment. So part of this is just making good choices at the grocery store. My weakness is ice cream. If I buy ice cream at the grocery store and it gets into my house, it's going to get eaten, even if I can, pass it up a few times. Eventually it's going to, get eaten. But if I don't buy it at the grocery store, I'm probably not even going to want it. And even if I want it, I'm probably not going to want it enough that I'm going to get out and leave my house and go out and get it. So I think, making use of your willpower at the grocery store means that you don't really have to do it at home as much, which is good. Bringing your lunch is often a good idea. It's a lot easier to make healthy choices kind of the night before at home when things are relatively calm than in the middle of a busy kind of hectic work day. And then we also tend to eat what we see. So if you put a fruit bowl out on the counter, or take your fruits and vegetables kind of out of your crisper drawer and put them kind of at eye level in your refrigerator so that they're the first thing that you see, you're a lot more likely to reach for them. And kind of the flip of that is if you have less healthy stuff in your house, it's better to keep it kind of in a cabinet or up on a high shelf so it's not kind of right there constantly tempting you. And then as far as exercise, the American Heart Association recommendation for exercise is to try to get 150 minutes a week, which, for most people, the best way to break that up is to do 30 minutes 5 times a week. Obviously, if you haven't been exercising, you don't want to jump right to that. You can kind of build up gradually to that, but it's a good thing to aim for. If you can't do the 30 minutes all at one time because you're too busy, then you can actually get a lot of the same benefits if you break it up and you do it in kind of smaller chunks. So 10 minutes 3 times a day. Sometimes people call this exercise snacks. So you just kind of do a little bit at a time. If that's easier and you can get it in that way, then that's fine. Trying to just build some exercise into your daily life, doing things like taking the stairs instead of the elevator. And instead of, driving around loops around the parking lot, trying to find the closest spot, just park a little farther away. Get a few, steps in on your way into the store, that kind of thing. Exercising with a friend can be really great for a lot of people. It makes it more fun. Somebody, you're looking forward to it. And it also adds some accountability because you're much less likely to, bail on a workout if you know that somebody else is there waiting for you. And another good tip, I think, is to try to bundle exercise with something that you like to do. So, in the winter, I find it really hard to get motivated to work out. I prefer to exercise outside. It's not really that fun for me to get on a treadmill or elliptical machine. But if I, pick out a show on Netflix or start listening to an exciting audiobook or something, and I make a deal with myself that I'm only going to watch that show or I'm only going to listen to that book when I'm exercising, then it turns it into something that I'm actually kind of more motivated to do because I want to see what happens in the next show or in the next chapter. And sometimes keeps me on the treadmill longer than I would have otherwise because I'm waiting to see what happens. So just in summary, type 2 diabetes is a large and growing public health problem. And we know that healthy lifestyle changes can help prevent prediabetes from progressing to type 2 diabetes. For people who have type 2 diabetes, good blood sugar control can help prevent the complications that we worry about so much. And then just a reminder that the BEATDiabetes is available as a free resource and tool to help people with diabetes prevention and management. And then here, it's just information about how to get in touch with us, our website. If you have any questions, I can answer them now, certainly, but if you have some after the talk, here's my email, the phone number for our office. And then we also have a Facebook page where we put some extra tips and information about diabetes prevention and management. So I will stop sharing my screen and I'm happy to answer any questions that anyone has.
Here's one in the chat. Is there an app that you can enter your food intake daily that will tell you how much sugar you have eaten?
Yeah, there are quite a few actually. I think one of the ones that I like the best, there's one called MyFitnessPal that has a lot of kind of built-in food information in it. It'll tell you a lot more than just sugar, but you can even like brand names and things like that. You can put a lot of information into that. There are others out there too, where you can kind of enter and you can kind of set up, if there are things that you eat commonly, they can become kind of favorites that you put in there.
just put a search in when you go on your App Store or Google Store for, I would think, monitoring food intake or daily food intake or something like that. A lot of the exercise ones have it built in as well. It tells you how many calories you burn as long as how many steps. So, but yeah. Let's see. Once you're diagnosed, will you always have diabetes?
Yeah, this is a good question. So there is a possibility of reversing diabetes if you can have your blood sugar back in normal range for a whole year off of any medications, then that's considered kind of being in kind of remission or having been reversed. It can be hard to do, but it can be doable, especially if you're kind of starting off at a point where there are lots of changes that you can make as far as kind of improving your diet and exercise and weight loss. So it definitely can happen, but it can be a challenge to do. I think certainly most people can definitely get their blood sugars adequately managed. For a lot of people, it does involve taking medicine, so that's not considered kind of being cured if you're on medicine, but you can manage it well enough that you won't end up with the complications that we worry about. And some people can really turn it around and have really dramatic improvements just with diet and exercise and get to the point where they wouldn't be considered diabetic anymore. Unfortunately, it does have a tendency to be progressive. So I guess the one thing that I would say is over time, just kind of like those risk factors increase when we get older. Sometimes with diabetes, even if you're kind of doing all the same things that were working for you last year, sometimes that insulin resistance can get worse through no fault of your own. And people find that they, where maybe you didn't need medicine, then you need a medicine. And then maybe if you need one medicine, you need two. And that doesn't mean necessarily that you're doing anything wrong. It just means that the underlying insulin resistance is progressing.
Another question, do you have to be diabetic in order to purchase one of the meters to measure your A1C at home? Does it have to be prescribed by a doctor?
So it does not have to be prescribed by a doctor. You can just go in and buy one in any pharmacy. I will say that the test strips can be a little bit on the expensive side. So you would need a prescription for those for them to be covered by your insurance. But you can just go buy one at the pharmacy if you're just kind of curious and want to know what it is.
Or can you see them?
Yeah, it's BEATDiabetes Program recommended. Yeah, so I think it can be good for anybody. I think, we have people with prediabetes sign up. We actually have a special program for people with prediabetes. So they would definitely have A1Cs less than 6.5. I think even people who, are kind of newly diagnosed diabetes or have diabetes that's pretty well controlled can find it helpful. Because there are the tips in there and then the reminders. So we have people who are everything from really well-controlled diabetes to people who join the program when their A1C is up in the 13s and 14s, and they're really kind of really struggling with really terrible control. And I think for the whole range of people, there are people who find it helpful. Would I explain A1C? Yes. So the A1C stands for hemoglobin A1C. And basically what happens is the sugar that's floating around in the bloodstream will kind of bind on to the hemoglobin, which is part of the red blood cell. And so hemoglobin A1C looks at how much sugar is attached to the hemoglobin on the blood cells. And the higher your blood sugar is, the more sugar is going to get attached to that. And because the red blood cell has a lifespan of around 2 to 3 months in the bloodstream, it looks at kind of your average blood sugar over a 2 to 3 month window. So that's why it's a nice test, because it kind of gives us an average test. If we just check your blood sugar, we just kind of know one point in time, which can be helpful, but it doesn't give us kind of the whole picture of everything that's going on in between. And a lot of times blood sugar, it doesn't just kind of stay nice and flat. It kind of goes up after you eat and, then goes down. And so the A1C is really useful because it kind of gives us an overall kind of average picture of how people's blood sugar it's doing. Okay, are there any medically directed weight loss programs in Charlottesville? I don't know, Satora, do you know the answer to that question? There definitely is Weight Watchers around.
Yeah, I know that I heard that UVA had a weight loss clinic. I'm not sure what that entails. I don't know if it's bariatric based or exactly how that works. I'm not familiar with it. At Martha Jefferson, we do not have a weight loss program in itself. We have the bariatric program, where obviously people, who are seeking surgery, bariatric surgery, there's a weight loss program associated with the bariatric program, but that is for bariatrics. And I'm not familiar with any, I don't work with it or haven't worked with any of the Weight Watchers program. It used to be, you would sign up and then there were meetings, in-person meetings, but I'm feeling like most of that might be online now, because I know that there's been numerous advertisements on the TV for Weight Watchers. Oprah Winfrey has been a spokesperson for that program, and there are specials going on where you can sign on for free and get like a month or two free. And I would think that they probably would match you up with a I'm going to say counselor or a spokesperson, someone that could work directly with you, but I know it's not the same as in person. So I'm not sure if there are any in-person meetings going on right now. But there should be some information if you go on the Weight Watchers website and check that out, because I know that, a lot of people who've been through the Weight Watchers program have been very, have lots of positive comments and, on the commercials. Of course, I know it is commercialized, so it looks, everybody looks happy and great and have lost weight, but it's supposed to be a good program.
I've definitely heard good things about it from patients who have done it too.
Yeah, I joined it years ago, so I don't know anything about it now.
And then there's another question, when looking at your test results, is it identified as A1C or something else? So probably if you were looking at kind of a list on my chart or a printed out lab test, it would probably say hemoglobin A1C was probably the most likely way that it would be written down. And then sometimes under it, it'll say kind of estimated average sugar, and it'll kind of tell you what the average sugar is kind of over time to kind of translate it into potentially a more helpful number. Although if you're, if you don't have diabetes and you haven't been checking your blood sugars regularly, that number may not mean that much to you either. Would you recommend the surgery? Is that the bariatric surgery? I mean, that's a really complicated question.
Yes.
That depends a little bit on, well, it depends a lot on kind of your individual situation. I think for some people, it can be really helpful. And it's actually, somebody had asked a question earlier about kind of reversing diabetes, and of all kind of the interventions that we have, bariatric surgery is the most effective at kind of curing and reversing diabetes. So it can make a big difference for the right person, but it's obviously, they're big surgeries. And so you have to really think through kind of the risks and benefits of that. There is both Centara and UVA have bariatric surgery programs. There's a lot of education, kind of patient education. They usually make you go to some classes so that you can learn more and really kind of think through whether or not it makes sense to you. But for some people, it can be really helpful.
Yes.
If you had to pick just one, well, usually your doctor will kind of pick for you. I tend to think that the A1C is usually kind of the best because it kind of looks at an average. But as far as kind of screening and looking at your general risk, either one would be fine. So if you've had either one, then I think it gives you a good enough sense as to what's, what your risk and kind of where you fall on the spectrum is. And then, for people who have diabetes, both tests are important. They kind of give you different information. The A1C kind of looks at your average risk, and it's correlated really well with the risk of complications, like we said. But as far as kind of really figuring out how your body is reacting to different things. So what, if I eat this kind of food, my blood sugar goes up. If I eat, if I eat a salad, it doesn't. What does exercise do to your blood sugar? So I think figuring out that stuff, the finger sticks can be really helpful. And that's also why you may know people who have the continuous glucose monitors. So they're like a little sensor that you can wear on yourself, and they have historically been used really commonly for people with type 1 diabetes, but are being increasingly used for people with type 2 diabetes. And they can tell you your blood sugar kind of constantly, and they're nice because then you can really kind of see the impact of what you're doing on your blood sugars, and it can kind of help you figure out what changes to make to keep them kind of more smooth and even. Yeah, I don't know that many of the details about kind of all the different bariatric surgeries. So I'm probably not the best person to ask about that. I think if you go online to the bariatric surgery websites, probably Centara has probably resources, I would guess, kind of on their page that can go over the different ones. The different procedures have different impacts on diabetes. So I know that the sleeve isn't as good for improving diabetes as a gastric bypass would be, for example, but it's also a smaller surgery. So that's another part of that kind of more complicated discussion about what the right surgery is.
There are seminars, or works, well, more like a seminar, I guess. Martha Jefferson offers through the bariatric. You can go on the Centara.com website and type in bariatric, and there are scheduled seminars for people to attend who are interested in learning more about the bariatric surgeries. I'm sure UVA might have something similar, but I can only speak to Martha Jefferson.
Yeah, I think pretty much any of those places do. And then the next question, that one looks like it's more for you about the next 3 sessions.
Okay, let's see. I think you've gotten this session confused with our other class. I have a separate 5-week class going that's on Wednesday evenings. This is a different educational program. It's part of our first Tuesday educational series that has been going on for a long time. So this session tonight is a one-time session. There's a separate class that I have going on Wednesday nights. We just started that one last week. And we have 3 more, 4, where we have tomorrow night and then 3 more sessions. So you should have already been signed up for that and enrolled. So that class has already started. We're not taking any new participants right now, but we will be offering a new class starting in April. So there will be information coming out about that. There was one up there about carbohydrates.
Okay. Yeah, so I mean, carbohydrate and kind of macronutrient stuff, there's a lot written about kind of what percentage of carbohydrate and fat and protein. I think for most people that is kind of overly complicated to try to calculate all that yourself, although some of the apps like we were talking about that will tell you how much sugar and carbohydrate and fat, they can give you a chance of that. I think for people with type 1 diabetes or kind of really complicated type 2 diabetes where they're on insulin, sometimes they need to do carbohydrate counting, but for most people that's not necessary. I think kind of sticking with something like that half plate rule, or with my plate, which is another kind of similar thing about just trying to build a healthy plate of food. It's generally kind of the best place to start for most people, because you can get really kind of lost in the weeds about kind of counting all these things. And I think it can kind of drive you crazy. Sodium is not kind of directly related to diabetes, but the general recommendation from the American Heart Association is that people stay under 2,300 milligrams. Most Americans are way over that. Again, kind of any of those kind of food tracking things are helpful for keeping an eye on how much of that you're getting, or just kind of looking at labels. You can see how much you're getting for people who have high blood pressure or congestive heart failure, things like that. The recommendation is even lower, more like 1,500 milligrams.
The comment about you can also do the bariatric session online. So is that you've taken the bariatric seminar online? Is that what you're saying? I'm not sure if that's seems like it's just comment that it's offered online. I'm not sure.
Well, thank you guys for being such a great audience. I really enjoyed talking to you. Yeah, and please don't hesitate to reach out. I can put our website in the chat, and then you can reach me at that. It has a phone number and email and everything if anybody has any questions that come up later tonight or later this week.
Yeah, and if anybody is interested or wants to call here for, I have the forms here if you want to fill out a paper copy, you're welcome to do that as well. And for any of my patients, I've mentioned it to several of my patients, and I have the forms visible in my clinic room. So we do have them here at Star Hill. I will put my number in the chat as well. Okay. That's my direct number to my office if anyone wants to chat with me. Thank you all so much for attendance. I think this has been our biggest attendance so far this year. This is our second First Tuesday educational series. We offer this educational series every first Tuesday of the month, and we have a featured guest speaker surrounding chronic disease education. So next month is April. And of course, because I'm thinking, I can't think right now. I'm forgetting who we have for April, but the flyer will be coming out soon for April. But we do have a featured guest each month on the first Tuesday of the month. And anyone else that's in my other class, yes, we will be meeting tomorrow evening at 6 o'clock. Thank you, everybody. Have a great evening. Thank you, Dr.
Thank you.
Flake.
Have a good night.
Enjoyed it. Thank you so much.
Thank you.
Thank you.
I'll leave it on in case anybody needs my information. Did anybody have any questions? Because you're muted if anyone's trying to talk. Okay, I'm just going to end for now. Thank you all so much for attending. Have a great evening. Okay.